Hi, I'm Dr. Alma. Today I'd like to talk about managing difficult behaviors of children. For 2 decades, I've been working with families and helping parents manage challenging behaviors of their children. And in my private practice, I have encountered families with children within the autism spectrum. There is a science to managing these difficult behaviors. It's called applied behavior analysis. But before we start, what is autism? There are 2 areas of functioning that will determine if the child has autism. First, some delays in social interaction. The second criteria is the language, which may look like some inability to speak, and for some, a lack of meaningful communication. They can be repetitive and not really able to engage people in conversation. That is what autism is in gist. Now, to talk about how to manage these challenging behaviors, we have to understand what happens in a particular behavior. And we call it the ABCs of difficult behaviors. A stands for antecedents of the behavior. What happens before the actual problematic behavior happens? If the child doesn't get enough sleep, it usually results in crankiness and temper tantrums. Sometimes the child is sensitive to noise or changes in schedule. Those are also triggers of unease in the child. B stands for the difficult behavior that we wish to address, which may be self-harming, like hitting oneself or harming other people. These behaviors can be distressing, especially if it happens frequently and with intensity. And C is the consequence of the targeted behavior. How do people react to the behaviors? And that determines if these behaviors will happen again and again. Does the adult or the frustrated parent yell or scream in shock? In so doing, there is a lot of attention given, which might even increase the frequency of the behavior displayed. So just remember the ABC of behaviors in trying to understand your child's challenging behaviors. If you're interested in more information about how to manage and help your child with these very difficult behaviors, please visit my website, visionofself.com. Thank you and have a great day.